VODI itself doesn't do health education. We have partners. We have students who come and have an opportunity to learn, get an urban experience, and understand how to work with an urban community, an urban minority community. So we have students that come from U of M School of Pharmacy.
The partnership benefits us hugely in terms of turning out health professionals who are going to be more equipped to solve the really complex issues within healthcare today and healthy communities. So we're realizing more and more that we can't just focus on what happens within the clinical encounter when they come into a physician's office or when they visit the pharmacist in their community. We have to really start looking more broadly, like I said, at the social determinants of health and how we might partner to come up with some solutions.
We are very fortunate that students were sent to us from these universities to participate in our programs, to learn about the impact model, to understand the importance of meeting community needs, and we gave the students an opportunity to learn about the social determinants of health and the role that that played in healthcare.
The service learning course, the goal of the course is to expose students to the social determinants of health, the access to care issues, income, education, whether people have healthy food or are encountering a lot of violence in their community. And so the IMPACT project actually addresses all of those issues in this collaborative fashion. So it was a great opportunity for our students to work with them and see what they're doing, but also to have one-on-one contact with community members who are coming in to talk about they do blood pressure checks on Wednesdays. Somebody's blood pressure is through the roof. And then they start talking about a home invasion the night before or an eviction notice. And so the students are learning that there's a lot more to hypertension than your exercise and your diet and your medication. It's also about what's going on in your life and how can we address those issues to improve health and healthcare. Honestly, a lot of our students there's a bit of a shock factor. Many of them come from more privileged backgrounds, so their initial response to driving through this community to get to the IMPACT program is, wow, there's a lot of boarded up buildings, wow, there's a lot of liquor stores, there's a McDonald's, there's fast food on the corner. And then their next reaction in meeting people is, oh, you're more or less just like me.
Students get excited and they get to understand what it's like to provide services to an uninsured, underserved community. They learn so much in terms of where they want to take their career.
The students came either through service learning projects, simply to help us on a day-to-day basis with our operations, or to participate in research. So I'm very proud of the fact that we helped 5 University of Michigan pharmacy students complete the research requirements for their doctorate program, as well as to work with a PhD student from Lesley University to complete her dissertation.